Welcome to the Close the Chapter podcast. I am Kristen Boyce, a licensed marriage and family therapist with a private practice, Pathways to Healing Counseling. Through conversations, education, strategies, and shared stories, we will be closing the chapter on all the thoughts, feelings, people, and circumstances that don't serve you anymore and open the door to possibilities and the real you. You won't want to miss an episode, so be sure to subscribe. Welcome to this week's Close the Chapter podcast. Do you think about the aging process? Maybe you struggle with the thought of aging. Many of us do. Maybe you're at a point in your life where you have a lot of fears around it, or you feel alone in it and you don't have a place to talk about this. We are going to talk about what the aging process is like, struggling with how to work through it. We talk about how to age well and work through anxiety and depression and what that looks like. I asked lots of questions that I know many clients have struggled with, and feeling like a burden or feeling afraid you're going to be a burden, feeling the fear of mobility or lack of mobility that you might have and how that'll impact your health and how you'll look. And I asked some of the tough questions. And if you want to continue this journey of life and really feel good about yourself and how to cope and cope well with the aging process, then this episode is for you. If you know someone that's on this journey that needs to hear this episode, please share it. That is how we help more people. We build this community that you belong to because you're here listening. And we can start these more deeper conversations that we're all craving. Really, truly, what I hear most of is the surface conversations. We're kind of over those. We want more meaning in life as we age. We want more depth. We want more connection that is more vulnerable. And these are the ways to do it. We can share these episodes. We can start having the conversations. And maybe it's with your parent. Maybe it's with a neighbor or a loved one that is going through the aging process and you're going through the aging process. Maybe it's you and you want friends to talk about this with. You're not alone. So let me introduce you to my guest. Dr. Julie Erickson is a clinical psychologist, author, and educator dedicated to improving mental health in late life. Her book, The Aging Well Workbook for Anxiety and Depression, is a seminal self-help book for older adults looking to improve their mental health later in life. Dr. Erickson maintains an active clinical practice in Toronto, Canada, and is an adjunct faculty member at the University of Toronto. She was a lovely guest and really dove deep into how do we age well and embrace each age and mentally and emotionally really feel centered in who we are. If you want the free guide, as you know, if you're listening for the first time, grab it. It's at Kristen D. Boyce, Kristen D. Boyce, BOICE.com/free resources. It will help you on this journey. And here is my helpful conversation with Dr. Julie Erickson. Welcome to this week's Close the Chapter podcast. This is a topic, I love it when we find topics that I really am passionate about and experts to speak into the subjects. We haven't talked too much about how to age and aging well with anxiety and depression. It's a subject that I think is pertinent and so many people are struggling with the aging process. So I am so excited to have my guest, Dr. Julie Erickson, with me today. Thank you so much, Dr. Erickson, for joining us today.
Thank you so much for having me. I'm so excited to be here with you.
When I found your book, I was like, I need to have her on the podcast. So tell us a little bit about yourself and why this particular subject on aging well is a passion of yours.
Yeah, so I am a clinical psychologist based out of Toronto, Canada, and I split my time between a private practice where I work with adults across the lifespan who are working on their mental health. I also do a bit of teaching at the University of Toronto, where I'm an adjunct faculty member, and do some writing, which of course culminated in my book, The Aging Well Workbook for Anxiety and Depression, which came out last year. And in terms of my interest in aging, and really wanting to do more work in this area. It actually got started in maybe an unlikely way, but one of my first jobs when I was a teenager, back when I was 16, was working in the recreation department of a nursing home. And at that time, I thought, well, this is a great gig. I basically get paid to socialize with older adults, but quickly learned through that experience just how rich later life is, and learned so much from my conversations with those older adults about the highs and lows of aging, and really just started to admire and respect and have a lot more reverence for that time in life. And it really pushed me to understand more about how we can help encourage healthy aging, as well as what gets in the way. What are the barriers to aging well? And clinical psychology was a really perfect path for me to be able to both study that and be able to help people learn how to age as best as they possibly can.
Why do you think we don't talk about it too much, the aging process and how it affects us emotionally?
Yeah, I think a lot of us have hangups about aging. We've come to see it as synonymous with decline or loss or vulnerability. And it's sort of next door to the idea of mortality, which none of us like to think about our own mortality. It sort of quite understandably elicits a lot of anxiety or even despair for people. So we haven't had a whole lot of societal or cultural messaging around aging, which facilitates us to talk about it more openly and less from a place of fear, but more out of a place of optimism or excitement or eager anticipation for all of the benefits that come with getting older. And there are a lot.
Yes. What do you see? How does aging impact anxiety and depression? What are the patterns? What are you seeing?
One of the good things to maybe highlight first and foremost is that the prevalence of most major anxiety disorders or depressive disorders actually tends to reduce as people get older. So, which is part of what we call kind of the paradox of aging, meaning that despite there being challenges and losses and things that are more difficult that come up in later life, there's also a lot of benefits from a psychological and emotional standpoint, including more emotional maturity and stability, as well as things like the prevalence of anxiety and mood disorders going down in later life. But that being said, obviously there still are a good number of older adults who might struggle with anxiety and depression in later life. And some of the things that tend to be maybe a little bit different about it are that it might present a bit differently than how it might with younger adults. So, for example, an older adult might first present to their general practitioner and talk a little bit about some of the physical sensations that come with an anxiety disorder or mood disorder. So they might be more likely to talk about having difficulty sleeping or struggling with an upset stomach or feeling restless more than they might be going to their GP to talk about, well, I'm really worrying a lot these days, right? Or I'm feeling a lot of hopelessness or worthlessness. Well, that might be one difference. The other difference tends to be what tends to activate difficulties with anxiety or depression in later life. And one of the more common things that tends to trigger these difficulties is a major physical health event. So whether it's a fall of some sort or needing a major operation or medical procedure or being diagnosed with a chronic physical health condition, all of these things can come with major life changes. They can change how you see yourself and start to maybe see yourself as a little bit more vulnerable than you used to. And so for a whole host of reasons can start to activate more difficulties with anxiety or depression, particularly for folks who have a history of some of those difficulties. So an older adult who struggled before at some point in their life with anxiety and depression is more likely to struggle with it in later life.
So what I'm finding with clients and friends and parents who are in the aging, I wish we could have a different name for it other than aging, like something more celebratory. Anyway,
Yeah. Yes.
you know what I'm saying?
We need a rebrand.
We need a rebrand. We need a rebrand. The one thing I hear is kind of feeling purposeless and worth and value and identity. Can you talk more about that?
Yes. So lots of things we could say about this. One first thing that I'll say about it is just sort of the impact of internalized ages on older adults. So ageism meaning prejudice or discrimination towards someone based on their age. And of course, this can occur no matter what age you are, but we tend to associate it a bit more with folks who are later in life. And ageism is probably the one ism that every single one of us will experience at some point in our lifetime. And one of the impacts of ageism, or at least internalized ageism, is as an older adult starting to feel like, well, do I matter as much anymore? Am I invisible? Like, what is my purpose here? So it's an insidious thing, but I think a really important thing to start to raise our awareness of how ageism operates in everyday life. And it can be everything from off the cuff comments around like, oh, Dad, you probably need help setting up your iPhone, don't you? Right? To other things like older adults being given less health information from their healthcare providers relative to younger adults, or older adults being overprescribed medications for the same sets of symptoms relative to younger adults, to, let's say, adults over the age of 50 who are 30% less likely to be called into job interviews, even though they might meet and have the same sets of qualifications as younger applicants for jobs. So ageism really is everywhere in a lot of respects, and internalized can lead older adults to really start to question themselves and to feel less worthwhile than they used to.
Yes, I think that's huge. I'm seeing that across the board, less worthwhile.
Yes. I think the other factor too, if we sort of bring it more at an individual level, is that older adults are undergoing a lot of different types of transitions in later life. And some of those can involve role transitions, right? So let's say shifting out of full-time work to retirement. And oftentimes some of those role transitions are quite an adjustment that can leave us feeling like, I'm a different person than I used to be. And how do I get my needs met for connection or autonomy or competence? That sometimes in the early stages of something like retirement, people feel aimless or a bit lost or struggling to find their footing.
What I'm hearing from some clients is if I don't work, then I'm going to die. I will atrophy in some way, my brain, my body. It's like almost like they equal that to, which makes sense. Like this is their identity. This is their worth. This is where it keeps them alive. And they're afraid that they will then atrophy.
Yes, absolutely. And I, on the one hand, get it, right? Work can be a really meaningful part of our identity, our purpose in life, how we get a variety of our different needs met. And certainly as I work with some older adults, some of them who say, I can't imagine myself ever fully retiring because at least some engagement, right, on the cognitive front or social front really feels good for me as a person. But the good news is, I mean, retirement is really a choose your own adventure type of thing these days. There's so many different ways to do retirement, whether you are still working a good portion of the time or scaling back altogether or having a mix of part-time work and leisure pursuits. It can look like a lot of different things.
How do people deal with internalized ageism if they're really struggling with feeling worthless and kind of discriminated against or not finding value? How do you help people deal with that?
Well, I think the really important critical first step is to start to raise awareness about what some ageist beliefs are. Because sometimes if we can start to name and identify what they are, we can start to pick up on when we're falling into them and when we are treating some of those beliefs as if they're truth. So for example, an ageist belief might be older adults are less capable of changing.
Yes.
Right. So
that one a lot. Well, they're
yeah.
never going to change.
Yeah, exactly. Even in my own practice, right? I'll have people say, oh, well, like, do older adults still benefit? Like, are they coming to therapy? Do they actually change? And that does sort of reflect this ageist belief, right? That older adults are less capable of changing. And there's plenty of other ageist beliefs too. Everything from, older adults being more stubborn or just more depressed or lonely, or older adults being asexual, right? A lot of these beliefs float around that tend to impact how older adults see themselves. So raising awareness of some of those things first and foremost is really important. I think the other thing we can do to combat ageist beliefs is to really be intentional about looking for counter examples to that. So look for whether it's people in your own network or beyond that really help defy a lot of those ageist stereotypes and beliefs. So even if it's Martha Stewart on the cover of Sports Illustrated magazine, right? Or someone in your network who is moving to a new city to immerse themselves in the Spanish language for 6 months. Whatever it is, look for counterexamples to some of these ageist stereotypes. And I think the other piece that you can do, and maybe one of the best pieces of advice, is to act as if these beliefs are not true. Because if you acted as if it is not true, right, that older adults can't change, you're going to throw a lot of your weight and your efforts towards bettering the quality of your life. And of course, those efforts are going to magnify and really be beneficial to you. So act as if some of these stereotypes are true. And you might find that, your personal experience allows you to see them as that.
So let's say someone says, I am feeling less motivated. There's two things. One is asking for help and I need more help and I don't want to be a burden on somebody. And two, I feel less motivated to put myself out there. I'm hearing those two things in particular. So can you speak to those two, what I would say somebody's rumbling through those two things?
Absolutely. So I think one thing that's important just to consider developmentally, right, that might help put some context around those two issues. It's just the fact that older adults in late life tend to be engaging in what we call social pruning, which is they start to be more intentional about who they're spending their time with. And they're starting to prioritize close, meaningful relationships. And they are deprioritizing the looser social connections. So older adult social networks are shrinking, yes. Part of that is due to their values, goals, motivations being a little bit different. So I guess why I bring that up is that if you have an older adult who's saying, I'm not super motivated, I'm really struggling to reach out to other people, then it's really important to bring that more into focus of what's actually going on in later life. Then if you're finding it challenging to feel motivated to reach out to this, that, or the other person, maybe that's kind of normal in late life. And maybe the focus could instead be on, are there one or two people in your life who you feel like you can be most yourself with? And can we look at where those more closer, intimate relationships are for you and help you start to take some gradual steps towards engaging with those people? So just capitalizing on the age-related changes that might be happening and not thrusting goals upon older adults that are maybe a younger person's goals.
Yeah.
If that makes sense.
So key. Yeah. And then how about feeling like a burden? So someone feels like I'm a burden. I don't want to be a burden. I don't want to ask for help, but I kind of sometimes need help. Or maybe they don't know where. Some people don't even have resources or know of resources to help. So walk us through that piece.
Yeah, a few things here. So when I'm working with an older adult who's really struggling to reach out out of fear of being a burden, talk a little bit about some of the research that demonstrates that there's a real discrepancy between how we experience asking for help and how other people experience asking for help. So if we experience it as burdensome, right, to be able to ask someone, hey, would you mind taking me to that doctor's appointment next week? Other people are experiencing as way less burdensome than we are. In fact, other people often feel quite privileged to be able to help and assist others. And it's those very acts that often help deepen the quality of a relationship, as opposed to keeping things more surface and superficial and just talking about the good stuff. So I think it's both important to acknowledge these things aren't experienced as burdensome as we feel like they are. And these are the very things that deepen relationships to a meaningful extent. We certainly don't deepen friendships by just talking about the good times. We deepen them by going through the hard stuff together.
Yeah, it's bonds you in a lot of ways. I mean, I think as we age, we want those deeper relations. Not everybody, but I think in general, we're more thirsty for deeper, meaningful relationships.
Absolutely. Now, the interesting thing, you maybe wonder why that is, right? Why would we be more hungry for more meaning or deeper connection as we get older? What's really interesting is that a professor at a Stanford University named Laura Karstensen has studied how the impact of time perspective starts to influence the choices that we make as we get older. So as we get older, we start to feel a bit like the clock is ticking. Time is running out. It's not as infinite as maybe we felt like it was when we were younger. And when we start to feel that time is running out, we do tend to prioritize the people and things that are most meaningful to us. And we really start to deprioritize the new, the question marks, the I don't knows, that type of stuff. So I think that is one of the factors that makes us more drawn to deeper, more meaningful connections as we get older.
Yeah, I love that. How do people work through the fear? Let me throw out some that I'm hearing. Okay. Fear my body's shutting down. Fear I'm getting dementia. I'm just throwing out different fears. Okay. And I'm not able to process information. Fear I can't do things for myself. Fear that I look bad and I'm aging and nobody's going to find me attractive or want me. So, or I'm gaining weight. Fear that I can't do what I used to be able to do. So these are some of the common fear that I'm going to lose relationships with my family members, my kids, my grandkids, that they won't want to spend time with me. So these are, I'm throwing a lot on the table. How do you help people work through their fears during the aging process?
Well, I think right off the bat, it's important to look at sort of where the fears are coming from. And for a lot of these fears, of course, there is a real kernel of truth and validity and reasonableness behind them. We know that cognitive decline, even normal age-related cognitive decline, is a normal part of aging. We also
That's a tough one. That's a tough one for folks.
It is a tough pill to swallow, right? Just like our bodies do change as we get older. They generally become less efficient, a little more prone to breaking down here or there as we get older. We also know that because of ageist stereotypes and norms, older bodies are not sexualized bodies anymore. So a lot of these things, there's a kernel of truth to a lot of them. But I think sometimes when people are coming to therapy, these fears start to feel more extreme than they might actually be realistically. So sometimes it helps, especially when you're working with a therapist who's got training in geriatric mental health, who can provide some information that's maybe a little bit more evidence-based about what actually is happening in later life. So for example, the vast majority of older adults will not develop dementia. So sure, the vast majority of older adults will experience some form of cognitive changes when they get older, but odds are the majority of us will not go on to develop Alzheimer's disease or another form of dementia. So I think it's important to maybe look at some of the facts of some of these things first and foremost. But I think the other piece that really helps in this is to develop a degree of acceptance around some of these changes, which might sound scary. What? You mean I have to accept that my body's shutting down and I can't rely on it as much as I used to anymore? But I think the really important thing to keep in mind about acceptance is that it doesn't mean that we're resigning ourselves to what's happening, right? Acceptance doesn't mean you're waving the white flag and saying, I give up. Acceptance is, I think, most simply an acknowledgement of the things that are under our control and that aren't under our control. So yeah, you're not going to have full control about the extent to which your body is aging, but you do have some degree of control over what type of physical activity you're capable of engaging in over the next week. And so oftentimes my work with older adults is really trying to strip away the things that of course you're worrying about, but that aren't really under your control, to really start to throw your full weight against the things that are. So I think that's another important component. And I think the other piece that I don't want to forget about, in addition to sort of looking at realistic fears, accepting where we're at, is just the role of autonomy as we age, feeling like we're the one in the driver's seat making decisions. And hanging on to your sense of autonomy and sense of capability is really critical, even as your cognition is changing or your body's undergoing different changes. hanging on to that sense of autonomy can help preserve a sense of control over what's happening in your life. And even if it's small things that you're doing to preserve a sense of autonomy, that goes a long way in shaping how you feel about your own life and to what extent you feel in control of things.
How much is the grieving process a part of the aging process?
It is a big part. Yeah, absolutely. As we're talking about things like changes in our bodies or physical appearances or changes in relationships that we're encountering, the underlying theme there is things aren't what they used to be. People feeling sad or feeling a sense of grief or loss or anger about some of those things. So grief can be a common theme that comes up in my work with older adult clients too. Again, it's important to sort of name that and not shy away from labeling it as such. But also as part of grief work, the acceptance and autonomy piece still really comes through as being important.
Yeah. And if they lose, let's say they can't drive anymore, that when we start losing the autonomy, talk us through that process. If someone starts losing just little bits of autonomy, how does that impact emotional health?
I mean, it can be very, very depressing for people. Like I'm even just thinking about, for any older adult who has mobility restrictions, like they can't drive anymore, or even they're in a wheelchair or using a walker, all of these things now introduce new barriers to how you live your life. And the things that you didn't have to think twice about before are going to now involve more planning, being more systematic, and you're not going to be able to do all the things that you used to do before. Classic example is a client of mine. She and her husband would normally meet a group of friends at a coffee shop every Sunday morning. This was a standing tradition for them. But the door of the coffee shop, the automatic door opener, was broken and hadn't been fixed. And the door was so heavy that my client, 80-year-old woman, is not able to open that door for herself, nor was her wheelchair-bound husband. So that literally closed the door right on that weekly standing tradition of going for coffee. And so it's things like that, that if you've got mobility issues or another type of disability, the world becomes harder to navigate. And a lot of older adults feel the brunt of that. It is disheartening. It's demoralizing. But a lot of the work I end up doing with people when they are in that position is really framing aging is ultimately about adaptation. To age successfully requires a lot of us to adapt how we're doing the things that we're doing, to still try to be as engaged in life as we possibly can, but it might mean we have to go about things a slightly different way. So if you're no longer able to drive, what are the options available to you to help you still get out to bridge or go see your trainer or get to synagogue? What are the things, the problem-solving solutions that we can really exploit to help make this still happen? And of course, it sucks to be in this position to have to do this. But most older adults are coming to therapy with a lifetime of experience solving problems. So that's also a huge strength that we can pull on in later life as we're dealing with these types of things that require us to adapt. Older adults are no stranger to problem solving and to figuring out solutions.
What are the keys to aging well, to work through anxiety and depression? Like, what would you say are the key factors? Maybe the top three. Are there top three factors in the process of aging well?
Off the top of my head, I think some of the things that are some of the most powerful predictors of how we age and how we feel about aging are, first and foremost, our relationships. So to what extent we feel like we have, and it doesn't have to be 100 friends, but a handful of people who you feel like you can be yourself with, who you can call upon for help if you needed it. And who you feel like offer you a meaningful form of support. That, what we know, is hugely correlated with not only how people feel about aging, but even things like mortality and life expectancy. When people are struggling with chronic loneliness, we know that's functionally equivalent to smoking cigarettes, in fact, in terms of the impact on mortality. So your social sphere, your social network, the quality of your social relationships is hugely predictive of how you feel in later life. I think the second piece that is really important is purpose.
Yes.
So having a reason to get up in the morning. And it doesn't have to be fancy, shiny, amazing sounding. It is just whatever to you helps you feel like you have a reason to get up and do something and use your own strengths or capabilities to your advantage. As an example, back when I used to work in the nursing home at age 16, I remember there was this one resident who it was his job every morning to go feed the fish in the fish tank. And because of mobility restrictions, this gentleman is quite a slow walker. And so it took him probably 45 minutes every morning to walk from his bedroom to the fish tank. But he did so diligently every single day, day in, day out. And so even if it's feeding the fish, it's like purpose matters tremendously.
Can I just pause right there? Because
Yes.
animals, I think, can be so therapeutic. If you have dogs or if you don't have pets, that's okay too. You can still find purpose outside of a pet. I mean, there's lots of options, gardening or visiting your neighbors or saying hi to people. But I do think like pets are they also can be burdensome. It depends on where you're at in the aging process.
Yes.
But pets can give us purpose too.
They absolutely can. Comfort, companionship, sense of responsibility, duty. Yeah, they do a lot of different things for us. And I think that continues in later life.
Yeah. How do people find their purpose? That's one of the things that I think they struggle with.
They can, particularly if it's people who, let's say, had a lot of their identity built up around, let's say, work. And if work is no longer a big part of their identity, or even things like parenting, once your parenting duties, although you could argue they're never really done, but once the vast majority of it is behind you, can leave some people feeling a bit aimless. What do I do with myself now, right? So I think in finding purpose, one of the things that I do with my clients that is a really good starting point is to just check into what your own values are as a person. What are the things that if we think about are most important to you in life? And we really try to think about the top 5. Examples of values could be things like physical activity or physical health. It could be community involvement. It could be personal growth and development. It could be family. It could be pets, whatever it is. But engaging in some sort of values clarification exercise can start to be the compass that directs us in different directions. And the good thing about values is they're not goals, meaning you don't reach an endpoint where it's like, check mark, I've done this, right? On to the next. Values are always a work in progress, and we can always do lots of different things to live in accordance with our values. So let's say as an older adult, you really value physical activity. You value being active. Right now, as you age and maybe struggle with different ailments or let's say mobility restrictions, how you live in accordance with that value might change and look different. But it's still very much possible to do things that honor what's most important to you. I think that's really critical. People age.
Makes sense. We have relationships, we have purpose. And then what would be the third, you would say?
Well, I think one of the biggest things that has an impact on how we age is how we feel physically. So there's no denying that quality of life to a certain extent is really impacted by, can I move freely in the world? Can I bathe myself? Am I able to go to a doctor's appointment if I need to on my own? Physical health is mental health and vice versa. So we do need to be intentional about how we're setting ourselves up as we age to be physically vibrant and engaged as much as we can. Now, that doesn't mean that we should operate under the guise that we can prevent any physical health condition under the sun. But I think it's more, how do I, to the best of my ability, set myself up to live a full, engaged, vibrant life and be able to adapt to the physical health challenges that might be on the horizon for me.
That makes sense.
And I think if we can live in that space, that sets people up.
Yes.
For success.
I think that's very helpful. As we kind of close out our time together, and this is my segment on personal growth in your own life, what book has been the most impactful in your life? If you had to pick a book,
gosh.
and it could be, just see what comes through. Just, it doesn't have to be is there one that bubbles up?
The one that immediately comes to mind when you said that, I didn't even have to think about it. It sort of came to me, is Bell Hooks's book called All About Love.
Ooh, I love the title. I haven't heard this one.
And Bell Hooks is just a phenomenal thinker, writer, academic, but she really talks and really reoriented how I think about love. So her definition of love is the willingness to extend oneself for the spiritual growth of another.
Whoa. I've never heard that defined that way.
I know. And so the book really unpacks that very idea and got me thinking about love in a way that I think is ultimately in everyone's best interest, my interest, and those around me. And I think it's been a really healthy reframe for me, particularly with ideas about romantic love.
I love that.
I highly recommend it. It's great. And she's written a bunch of other books too that are real game changers, perspective shifters. So she's wonderful.
Okay, I'm going to check that out. Thank you for sharing that. Is there anything else that we did not cover that you thought was important about the aging well process with anxiety and depression?
The one thing I'll flag that I didn't get a chance to before, but it can be one of the reasons that older adults struggle to access mental health care. It's not actually about stigma or as much about stigma. It's not necessarily as much about having kind of negative attitudes about seeking help. It's actually that older adults have lower rates of mental health literacy. So they're just not coming in with the same type of information or knowledge about what is anxiety and what are the treatments that are available and who do I go to for help if I need some of those treatments. They're just not coming in with that same type of knowledge as, say, younger adults would. And younger adults in the age of TikTok and Instagram mental health, they're getting a lot of information about what are the symptoms of various types of disorders and what do treatments consist of and how effective are they. So older adults need better access to good quality mental health information. And oftentimes they're going to be visiting their GP first, their general practitioner first for that type of information. But I think broadly, we can be doing a much better job to try to disseminate mental health information to older adults such that it removes that as a barrier to seeking treatment.
I think that's really helpful to know and something we don't think about. Mm-hmm. We think that we're in the information age and it's just out there.
Yeah, everybody has it. Everybody knows
it. Yeah, and that's not true. That's not the facts.
That's it.
Yeah. So thank you for sharing that. Where can people find you? If they're like, I really like Dr. Erickson and I want to know more about her, where can they find you?
Yeah. So probably the easiest way is through my website, which is drjulieerickson.com. And Erickson is spelled a bajillion different ways. So in this case, it's Erickson. So that's probably the easiest way to reach me. You can also find me on LinkedIn, Dr. Julie Erickson. Would love to connect if other people have questions or people who are just eager to learn more about aging and how to do it better.
And I'll link your book in the show notes. So feel free to grab that. I think it's a wonderful resource for anybody on the path. We all are going to be on this path. Well, I'm on the path. We all are on the path. I mean, I'm at halftime. So this is it. This is where we start to really dig in and find who you are and finding your meaning in this life in each moment. So thank you for being on the show to talk about this very, very important topic.
Oh, thank you so much. And thanks for creating space and prioritizing it to the extent that you are, because aging for the most part isn't a sexy topic to people. So it's really important that we start to change that narrative and start to see it in a different light. So thank you for helping with that.
Yes. I would love it if people could talk to each other about it in a real meaningful way about the emotions that come with it and how you're feeling and what's coming up for you and your grief and your fears. Because we can bring it to the light. I feel like that's really what it's about.
Absolutely. Once it's just more commonplace to talk about, it takes a lot of the scariness out of it and allows us to approach it in, I think, a healthier way.
Yes. So thank you, Dr. Julie Erickson, for the work you're doing in the world. And we are grateful for your time today.
Thank you.
Thank you so much for listening to the Close the Chapter podcast. My hope is that you took home some actionable steps along with motivation, inspiration, and hope for making sustainable change in your life. If you enjoyed this episode, click the subscribe button to be sure to get the updated episodes every week and share with a friend or a family member. For more information about how to get connected, visit Kristen, Kristen, Boyce, Boice.com. Thanks and have a great day.